Welcome back, my friends, to another job lead video. If you are new here, my name is Lindsay, and I am always searching the internet for the best work from home jobs available and posting them in hopes that it will help someone find the perfect work from home career for them. Today we have 7 companies in the healthcare field hiring work from home remote. Some of them offer computer equipment provided. Some of them are non-phone based, while some of them are phone based. Hopefully there is something for everyone. Unfortunately, these are all for my US-based viewers only, but let's just dive on in. First up, we have a customer care specialist for Cardinal Health, and I do believe Cardinal Health is actually hiring multiple people in this role, and so you will be responsible for answering inbound calls from customers to place orders or reorders of medical supplies. Agents will act as a liaison, problem-solving order issues, researching accounts, and providing resolutions in a high-volume call center. This does require a high school diploma, GED, or equivalent work experience, and it says preferred, not required. 2 to 4 years of experience preferred, but not required. They do require prior computer experience using Microsoft Office. That's Word, Excel, PowerPoint, Outlook, OneNote, those sorts of things. They prefer someone who has a background in customer service or who has familiar with call center phone systems. They need someone who has great communication and active listening skills, excellent phone skills, and is focused on quality. They're also looking for someone who has attention to detail and the capacity to navigate stressful situations with ease and the ability to achieve daily call center metrics. So as a customer care specialist, you would be responsible for providing customer assistance for order placing, product information, order status, order discrepancies, or any customer complaints for approximately 60 to 80 incoming calls per day. You would be answering the incoming phone calls from customers, caregivers, or referral sources. So you need to have the ability to handle high call volumes day to day and navigate multiple computer programs throughout the workday. You will process orders for new and existing customers. You'll use provided resources and companies' websites to navigate customer concerns, and you will consult with your supervisor and team lead if any complex problems arise. Now, as far as the shift goes, your new hire training will be Monday through Friday, 8:30 a.m. to 5 p.m. Eastern Standard Time. Of course, attendance is required for that. Once you've completed the training, you'll take part in a shift bid to determine your schedule. These positions are full-time, and you are required to have the flexibility to work any shift schedule. Their shift schedules are 8 a.m. between the hours of 8 a.m. to 9 p.m. Eastern Standard Time, Monday through Friday, and 9 a.m. to 3 p.m. Eastern Standard Time on Saturday. And so this is a full-time work from home, so you will need a quiet environment, distraction-free, and access to high-speed internet. It says they will provide you with the computer technology and equipment needed to successfully perform the job. All you need to do is have the internet connection, and they will give you all the computer equipment needed. So they do also provide benefits of medical, dental, and vision, 401k matching, and 23 days of paid time off after you work a 90-day probation period. And the salary range for this position is anywhere from $15 an hour to $18.75 an hour. Next up, Spectrum Healthcare is hiring a remote billing specialist to work Monday through Friday, 8 a.m. to 5 p.m. The billing specialist is responsible for financial reporting, full revenue cycle management, daily cash deposits, and productivity reporting. This position is responsible for all aspects of Spectrum billing and works closely with compliance, quality, and accounting teams. And you will audit charges for accuracy and submit claims to Medicaid, Medicare, and commercial insurance payers. You may also post post payments and denials from daily deposit remittances, and balance the deposit log. If any claims are denied by the insurance company, you will follow up on those and work with the insurance company to overturn that denial and get payment for services. So you need to understand ICD-10 codes, diagnosis codes, and CPT coding. This does require a high school diploma or GED, but no college degree is required, and they would like you to have a minimum of 2 years experience already processing claims or general insurance, and experience with the electronic claims processing process of resubmissions, appeals, and remittance advices. They do offer standard benefit packages such as health, dental, and vision insurance, paid time off, and 401ks, and the salary for this position is not posted. Moving right along, University Hospitals is hiring a revenue cycle Precert specialist. And in the job description, it does say in big bold letters, remote work opportunity available. So this should be a remote job. And it says, as an essential member of their revenue cycle team, the Precert specialist makes sure that authorizations for outpatient testing, ambulatory, and inpatient services are obtained before these services are actually rendered to the patient. The successful completion of tasks performed by this position directly impacts denials and reimbursement from the insurance payers, so you need to be skilled in patient-physician relations, registration, scheduling, and pre-certification. Some of the duties will be verifying Precert's inpatient, outpatient services to ensure that reimbursements from insurance companies are made. You need to master skills relating to insurance coverage, benefits, rules and regulations, and allocation of plans so that you know what you need to be asking the insurance companies for. You will verify and allocate your insurance plans electronically, eligibility tools. You may have to make phone calls to the insurance companies occasionally. You'll submit timely electronic and verbal notifications and clinical documentation being medical records, in accordance with contractual requirements by the insurance company. You'll effectively communicate using telephone, emails, and correspondence, and you need to perform all other duties assigned by the department. Now, as far as qualifications go, 1 year of experience in hospital revenue cycle healthcare or working with insurance companies is required. A high school diploma or GED is required, but no college degree. Knowledge of managed care insurance requirements is essential, and ability to function independently as a team player in a fast-paced environment, and also strong written and verbal communication skills. And you need to have good computer skills, including Microsoft Office. And again, no pay is listed for this position. If you get an interview, you would have to discuss that with them at that time. Just a little disclaimer, I do not work for any of these companies, so I don't have any inside knowledge. The only information I have is what is in the job posting. I just simply share what I come across online. All right. CareCentrix is hiring a care coordinator patient advocate to work remotely. Now, the patient advocate is responsible for reviewing and preparing data and demographics on patients that have been recently discharged from the hospital prior to an initial assessment call with a nurse coach. You will participate in the collection and documentation of all required data for end-to-end seamless care. This data generates reports and maintains the clinical program goals. And the hours for this position are Monday through Friday, 11 a.m. to 8 p.m. Eastern Standard Time, with a weekend rotation Saturday or Sunday. So this is like a midday shift. If you're not an early riser, this may be a good fit for you. So in this position, you will collect and document all required data on patients recently discharged to prepare them for the nurse coach. You'll be responsible for serving patients, making incoming calls with questions, and returning messages to be scheduled with nurse coaches. You'll understand that timely and accurate documentation is part of the success. You'll provide outreach to patients to check in on non-clinical issue resolution. So you must be committed with high quality standards. because you will be participating and providing feedback when implementing process changes and helping lead the way for the company. This does require a high school diploma or equivalent plus a minimum of 1 year medical terminology or medical services experience, but no college degree. They would like you to have 2 years insurance or quality improvement or healthcare operations. They need you to be able to demonstrate negotiation skills, self-confidence, and they want you to be results driven. You also need to have knowledge in basic spreadsheet, word processing, and data entry skills, and be comfortable in a computer-based environment. They do offer basic benefits as far as paid time off, 401k, and health insurance. And then they do have a minimum of $17 an hour and a maximum of $22 an hour. So the pay range for this would be anywhere from $17 to $22 an hour. All right, United Health Group, that's part of United Healthcare, has a remote client service specialist position open. This position is full-time, Monday through Friday. Employees are required to have flexibility to work any 8-hour shift during their normal business hours, which run anywhere from 8 o'clock a.m. to 5:30 p.m. And it says that primary responsibilities for this job are to direct requests relating to member care pending, upfront billing resolutions, member refunds, balance billing, provider contract disputes, claims errors, missing claims, benefits discrepancies, member eligibility or data issues, or claims inquiries like the payment or issues with claims. Your duties and tasks are to client advocate as the liaison on all issues affecting members and clients or providers. You coordinate with various internal and external departments to resolve all the client, member, and U.S. provider inquiries. You'll bring forth any trend that you find to your supervisor, and you'll strategize to improve internal processes necessary. So this position does require either a high school diploma, GED, or equivalent experience. So enough experience is enough that no degree is needed. They would like 4 years experience working in a customer-focused environment, so any kind of a customer service experience. Again, the ability to work the 8-hour shift. And so you must live in a location that you can get high-speed internet access as part of the telecommuting requirements. They do want you to have excellent verbal and written communication skills, be punctual but flexible, and have the ability to work independently. Now, the pay for this job is going to depend on experience plus location, but it is stated because of laws that require certain states to actually disclose upfront in the job postings the salary. Colorado residents go from $17.12 an hour all the way to $30.34 an hour. Nevada residents, it's a little bit higher at $18.80 an hour to $33.41 an hour. So it looks like the going rate for this position is anywhere from $17 an hour to $33 an hour. So depending on your experience and the state you live in is what you would be paid, but you could make all the way up to $33.41 an hour. Moving right along, I promise we are almost to the end. Southeast Primary Care Partners is hiring a certified coder, which includes a $2,000 sign-on bonus. Now, certified coders review medical records to make sure that claims are coded correctly so that the proper billing takes place. You participate in audits and evaluate if selected codes were accurate, and you improve coding issues as identified. You must meet quality standards, following both official coding guidelines and their risk adjustment guidelines. Position is fully remote, work from home, flexible, but it does say after initial onboarding and training. So it is a possibility that you would have to go in for training, and this position is in Alpharetta, Georgia. So if you live in Georgia close to that, this might be something that is good for you. If not, and you get an interview, you might want to ask them if you're required to come in for training. That sign-on bonus is paid in two different parts. One, once you've worked for 90 days, and the other half once you've worked for 180 days. Now, while this position only requires a high school diploma or GED and does not require any kind of college degree, it is required that you are a certified coder through AAPC, so you have to have the CPC certification. You also need excellent written and verbal communication skills, be well organized and detail oriented, and you need previous primary care experience as a plus but not required. But you do need the ability to code using ICD-10 code books and computer proficiency, including Microsoft Office. And last but not least, we have Apria Healthcare, I hope I'm saying that correct, is hiring a customer service specialist remote to work from home. This is a full-time job, and this position is responsible for identifying and resolving customer issues and answering customer inquiries regarding the status of their order. So you will handle continuous work volume by interacting with patients and referrals via inbound and outbound phone calls, email, fax, chat, text, web inquiries, and other electronic sources. So while it is a phone-based customer service job, it will not be 100% on the phone, so you will get a break from the phone. You will receive and process order requests from referrals for durable medical equipment and healthcare services. You'll provide accurate information and updates related to new orders, resupplies, pickups, and exchanges. You'll demonstrate professionalism and provide high-quality service with the patients and caregivers. You'll resolve patient complaints or escalations, and you will comply with and adhere to all regulatory compliance areas for best practices, and you'll perform any other duties that is required. For the minimum required qualifications, it does require a high school diploma or GED, but no college degree. 1 to 3 years of call center experience is preferred, but not required, and healthcare customer service experience preferred, but not required. They do prefer someone who has experience working at home remote before, but it is not required. This position does not require any certificates or licenses of any kind. Now, they do offer benefit packages with medical, dental, vision, 401k plans, paid time off. They have employee discount programs and education assistance and career advancement opportunities. This is a 40-hour-a-week job, and the salary range is $16 an hour to $16.60 an hour, depending on location. That was a lot. I was trying to include different healthcare positions than I did in my last healthcare video to try to get a little something for everyone. Leave in the comments down below if you're interested in a healthcare job, what part of healthcare you're looking for. You want billing, you want coding, you want customer service, you want anything that's healthcare. Please comment down below and let me know so that I can be on the lookout. This has been a lot of information. If you are still with me, I want to say thank you so much for watching and supporting me. You guys are awesome, and I will be back shortly with yet another work from home job lead. 2 videos will be popping up on your screen. One I picked for you and the other YouTube picked for you that you might enjoy next. Please subscribe and hit the bell icon so you never miss another work from home or money making video from me. Thank you so much for watching, and I'll catch you in the next one.